Hey everyone, Khalid here. Welcome back to Clinical Physio. Thank you so much for joining us for another case study. This patient has neck pain. If you like this video, if you enjoy it, please support us by smashing that like button. And otherwise, let's dive in with this patient's subjective history. So we have a 70-year-old female who's presenting with a 3-week history of neck pain. However, in the last 2 weeks, she's also noticed that she's been experiencing other symptoms. She's been getting bilateral paresthesia, tingling sensation in both of her hands, and it seems to be around a wide area in her hand. It's not one or two particular fingers. It kind of feels like it's the whole thing, and it's on both sides. She's also been noticing that in the last 2 weeks, she's been struggling with function and strength in her hands. She finds that it's difficult to do fine motor tasks like buttoning up her blouse. And she also finds that she once dropped a cup of tea in the last 2 weeks, which made her quite alarmed because that's not something that she's experienced before. She's also noticed another strange symptom that she's really unsure about because her legs seem to be affected as well. She feels like she's been struggling with her balance. She feels as if she's lost a little bit of strength and coordination in her legs, and that's also been worrying her. She hasn't had any particular injury, trauma, or she can't think of any other reason why these symptoms may have come on. And otherwise, she has a relatively good general health for her age, no past medical history of anything serious, just some quite concerning recent symptoms that she's certainly worried about. So next we take a look at her objective assessment, and there are lots of things going on here. First of all, when we observe the patient walking, we can see that she has an ataxic gait. It looks like she doesn't quite have the coordination and control of her legs. It seems as if there's a little bit of flopping of the feet, and it's not something that she's able to correct. We then look at her active range of movement. We look at her shoulders in terms of active range of movement. It doesn't seem to be too many problems there. However, she clearly has reduced cervical spine range of movement. It's painful in all directions. Extension is clearly the most irritable movement, where she only has 50% range of movement before it starts aggravating her neck. Then we look at some other specific neurological tests. We look at her myotomes, and it's clear that on both sides, for C8 and T1, there is a reduction in strength on both the right and left sides with only 4 out of 5 strength. Whilst there isn't any big loss of dermatomal sensation, we do see changes in her reflexes. When you do the triceps reflex, it appears that there is an increased reflex response, hyperreflexia, on both the right and the left sides. Interestingly, her biceps reflex wasn't affected. When we do other tests, such as her Hoffman's test and her Babinski's test, there is a positive sign on both her right and left sides for both of these tests, which does give us some really clear clues as to what might be going on. So now it's over to you, ladies and gentlemen. This is your opportunity to analyse the case, write down your thoughts, write down what you think the diagnosis is. Join us in a second where we'll go through all the clinical reasoning with you. Okay everyone, time's up. Let's go through the answer and the clinical reasoning. So unfortunately, from the symptoms that this patient was presenting with, it was clear that she had signs of cervical spine myelopathy. So let's talk through what this is. So in the middle of our spine, of course, we have the spinal cord, and a myelopathy is where we have a spinal cord compression. This patient was presenting with signs of cervical spine myelopathy, and in particular degenerative cervical myelopathy, which is where we have narrowing around the spinal canal where the spinal cord runs due to degenerative changes, which causes a compression of the spinal cord within the cervical spine. So that was what was going on for this patient, and it really does explain a lot of the symptoms that she was experiencing. First of all, the fact that she was experiencing bilateral symptoms, right and left-sided, because of course when the spinal cord is compressed, it will affect the signal to both the right and left sides. So we saw that she was experiencing a clumsiness in both of her hands. She was experiencing myotomal changes on both sides. We saw that she had reflex changes on both sides. That is all linked to the fact that she has a central compression of the spinal cord. One of the other really important things is that she was experiencing positive Hoffman's test and Babinski's test. If you know your upper motor neuron tests, you will know that both of these are tests that we use to look for signs of an upper motor neuron lesion, a lesion of the brain and or the spinal cord. Now, of course, cervical myelopathy is a spinal cord compression, therefore is a pathology of the spinal cord, and therefore we do see patients have a positive response on these tests. And that was one of the biggest giveaways for us that she may have a spinal cord compression, might have cervical myelopathy. The fact that she has bilateral hyperreflexia, increased reflex response for the triceps, is also a potential sign of an upper motor neuron lesion. And we look at those changes in her legs. She was getting those balance changes. She felt like there was a loss of power there. Think about the fact that when you have a compression of the spinal cord in the cervical spine, that compression will affect all levels below it, and therefore it will affect all the way down to the legs as well, which is why she was experiencing those gait changes. So it's really important when you have patients who have leg symptoms, always just double check the cervical spine. Just ask, do you have any neck pain? And if they do, make sure you go through the process of assessing the cervical spine as well. Make sure you do your upper motor neuron lesion tests, because it could be that the cervical spine is affecting the nerves in the legs. So what do we do for this patient? I know that everyone loves to hear what our treatment strategies are when it comes to these case studies. And the question here is, do we treat this patient? Do we treat their neck? Or should we be referring them on for further investigations? There is no doubt in my mind for this particular patient, I would not be treating this patient within physiotherapy. The immediate thing to do would be to refer that patient on for further investigations, particularly an MRI scan to look at the cervical spine to see if she does indeed have a spinal cord compression. The reason being is that if this is left untreated, it could lead to further deterioration of her nerves. And if that means that she loses even more power and more function in both the arms and the legs, that could be catastrophic for her hobbies, her life, and daily function. So therefore, we would definitely be referring this patient on for an MRI scan. We'd probably be referring them on to the orthopedic surgeons to conduct those MRI scans to see whether or not surgery is indicated to reduce the compression on the spinal cord and help this patient reduce their symptoms. So everyone, I really hope you've enjoyed this case study. If you have, please support us by smashing that like button. It's the number one thing you could do to help our YouTube channel. Remember, we've got loads of brilliant other resources on our Instagram account at Clinical Physio. Be sure to give us a follow there. And we also have our TikTok channel, clinical.physio. You can follow us there too. Now, if you want more learning from case studies, make sure you check out our membership platform, link in the description below, member.clinicalphysio.com. As a part of membership, you'll have access to the Case Study Club, a brilliant resource where we have case studies in MSK, respiratory and neuro, where you'll be able to learn from professionals, learn from the experts to see how they use case studies to improve your learning and your clinical reasoning. So thank you so much for watching. My name's Khalid. Look forward to seeing you soon here on Clinical Physio.